We've also got Jeanne joining us. Have I said that right?
You are?
Yeah.
Well done.
From St. Rocco's Bereavement Café, so she's going to tell some of our members about what they offer.
So, like I say, my name's Jeanne. I'm one of the counselling practitioners at the hospice. So we do a bereavement service, which is the Bereavement Café, and it's run twice monthly. So one is at Bank Park Pavilion, which is right near Golden Gate in the town centre, and the other one is run at Stockton Heath Pavilion, which is right near the library in Stockton Heath. So the runners are drop-in. You don't have to have any association with the hospice at all, and it doesn't have to be a specific bereavement. It can be a raw bereavement, actually new bereavement, or it can be many years ago. There's no sort of time scale on bereavement. Also, as well, you don't have to have a Warrington postcode. You can just come from any areas. We do get people from Liverpool and Chester,
really?
Wirral,
Wow.
Wigan,
Wow.
and all over.
All Cheshire.
Oh, yeah, Cheshire. Quite a lot of places everywhere, really. Some people come
London.
every single session.
Yeah, no, maybe not that far.
Not that far.
You said everywhere.
Yeah. We have got people from Chester, which is the longest, and Liverpool's the longest, and Wirral, yeah. So, but we welcome anybody. If anybody comes and wants to pop in, that's not a problem at all. We can offer a one-to-one therapeutic listening service. We don't offer counselling. This isn't a counselling service. It's a support for bereavement. So how it works basically, you come into bereavement, we welcome you, and then you can ask whether you want to sit with one-to-one, talk to one of our volunteers, or you want to sit in a group like we're doing today. And talk about, if you want to talk one-to-one, that's not a problem. Then we sit you with a volunteer, and you can tell them your story and what's going on for you, and they'll keep you sort of, listen to your story and keep you safe. We'll offer you a drink, you can have a cake. And some people come for maybe half a session, they come in and then go. Some people stay for the whole session, some people come every single time, some people go once in a while. So we're trying to signpost as well from there. So we, like for instance, if somebody came and said, well, I feel isolated, now I know about this, I would be saying, well, have you tried this place? That would stop the isolation. Because with bereavement, there's multiple losses, because you might have lost your best friend, you might have lost the person that you go to dinner with, you might go, well, we used to go for a walk together, we might go on holidays, or whatever it may be. So a lot of isolation happens throughout bereavement. Not always.
Twice a month.
Twice a month, so it's on the second Tuesday and the last Tuesday of every month. So the Bank Park one was the last Tuesday. I've got a calendar date which I'll leave, and I've also got the addresses as well, so I'll leave all this information anyway. And you just can sit and talk to one of our volunteers. So it's been going quite a few years. We had to stop it through COVID, because we were asked to do that, and then we've sort of started up again from there. But we get population, sometimes it's maybe 20 people, sometimes it's 32 people.
Amazing.
So there's quite a lot of people there, but there will always be, if we can fit you in and we can get you to sit with somebody, we will always make room for you.
So you don't need to book on?
No, drop in, and you, like I said, the main things are, you don't have to have a Warrington postcode, it's any age. We've got sort of from 13 years of age up to, like I say, 90s. That populate it, so no age group, no Warrington postcode, bereavement length doesn't matter.
Yes, it doesn't matter if it was like 20 years ago or like a few months ago.
Or whatever, yeah. And also, you don't need to have any connection at all with the hospice. You don't need to have ever gone in there, you know, so that's something there. But I'll leave you the leaflets, I'll leave you the dates, and like I said, we'll keep you safe. When you come, we'll support you when you're there.
You said an age for kids as well?
Pardon?
For kids as well?
Well, we've got one child that comes, she's 14, and she comes with her dad. So the two of them come together. If you've got children that are bereaved, we recommend child bereavement services in Widnes. You can get them online, and they're more specific for younger children and children who are.
There's many problems about teenagers, for example. that's fine.
Bereavement, is it? Yeah. So if you're coming along, there's nothing stopping you bringing the teenagers. But if you want more specific child bereavement, they're an organisation, they will support you. They do it online and on the phone as well. And they also give you support to support you as well on that side. But, you know, if you want to pop in, like I say, see how it is, because obviously it may not be suitable for them, but you'll know if they're suitable for them. We will make you welcome if you came. We've not sort of say no, we don't come in. So see how they feel about it. And maybe that you just sort of see how it feels for them first of all, and may not stay. You might want to go, but you can sort of test the waters that way. But yeah, I would say, like I say, we have two 14-year-olds. That one of them comes regularly, one of them comes now and again. So they both lost their parents. So it's a support there. But like I say, it's not counselling as such; it's support.
So what kind of support you offer now?
So
What kind of support?
With a cafe, do you mean? It's just somewhere to talk, somewhere to actually support you in that way.
Therapeutic, but not therapy.
Somebody to listen to you, what's going on for you.
So conversation, talking.
But we can also signpost you to other organisations if that's not suitable as well.
Would you be able to let the viewers know as well about what we were chatting about before, about going through a diagnosis?
Yeah, so the hospice as itself, so St Rocco's obviously is 40 years old, so showing our
Yeah, I saw that on your little logo banner. Yeah.
So within the hospice, they have, so the services in the hospice are for people with a diagnosis. And we tend to offer, they're normally referred by doctors, or if there is such as Macmillan or district nurses or adult social services, they tend to be the referral points. If they've got a diagnosis, they'll actually be among the palliative care. They have an association with the hospice. So there are lots of things that we do to support patients and their primary carers. So within the counselling and emotional care team, we're a very small group, but what we tend to do is we offer one-to-one counselling for patients with a diagnosis and primary carers. And we offer 6 sessions, and they tend to be face-to-face. The Bereavement Café is obviously for a wider area. And then within the hospice as well, there is a afternoon we-care cafe, which happens on a Tuesday from 1 till 3:30 within the hospice, and that's open for patients with a diagnosis and the primary carer. So they can come and get maybe a little bit of treatment, holistic treatment, or they can play a game of bingo, or they can just have a sit and chat with people there. And then there's also the craft part of it as well, so if you wanted to join in that and that's more therapeutic for you, you can obviously tap into that. There's also things like we do walks as well, and we also do, depends on the patients, how fit and healthy they are, and also things like just a connection. We do lots of events that they can attend as well. So within the hospice, the actual criteria for having care within the hospice is patient with a diagnosis and primary carer. So that's who we cover within the hospice. But this outreach with a cafe, there's no...
Sounds great.
Yeah.
Sounds great.
Yeah.
Yeah. And it is a nice place. So the hospice is made up of 2 sections. So we have 10-bed hospice, and then we have a vitality centre. And the vitality centre tends to be a port of call for information, updates, like I say, other social activities with outside people who are sort of just coming in maybe for some pain managing, things like that. So they do all that there as well.
Okay. Thank you so much for coming.
No
Tell all
problem
our
at all.
members what you do. Thank you.